So joining me on this conversation, I have Mark K. Agri, who is the CEO of Prime Care Digital Technology Solutions. And we also have Andrew Ni Ofori Anan, who is a member of PSGH, which is the Pharmaceutical Society of Ghana, Greater Accra Media Coordinator. Okay, so gentlemen, welcome on the show.
Thank you.
You're absolutely welcome. So today we're going to talk about the EPharmacy policy. And just to bring us back to last week when the Vice President addressed the nation, he mentioned a few things regarding the EPharmacy in terms of where it has reached now and how it's going to be implemented. And a lot of people had a lot of questions to ask about the EPharmacy. Like, what is the EPharmacy? How is it going to benefit us Ghanaians and benefit the pharmaceutical industry as well? So that's what we're going to talk about. That's what we're going to talk about today. So let me start with you and ask you, what exactly is the EPharmacy policy?
Well, the EPharmacy by itself is just the idea of folks being able to purchase medication online. The basics of it, that's it. Now, the question about policy has to do with a lot more with what the governments want to do behind the implementation of that item, right? And also what it means for the pharmaceutical industry and then you and I as customers or patients who need medication. So basically, simplicity, ease of purchase, right? And then cost savings, basically, is what that is supposed to provide to the patient. But underneath all of that is a question of implementation. How we're going to get this implemented, what are some of the pitfalls within that, what use cases are we going to use to verify that this is both efficient for both the pharmacies who are going to do the dispensing and the patients who are going to purchase the drugs.
Okay, and let me also come to Andrew. Andrew, are you with me?
Yes, I am.
Okay, so Andrew, you are a member of the Pharmaceutical Society of Ghana. So with that being said, can you also give us your understanding of what the EPharmacy is?
So the EPharmacy is simply a national platform which gives access to every Ghanaian with access to an electronic device to get access to pharmaceutical care, quality pharmaceutical care, and safe pharmaceutical care. Simply put.
Okay, so now let me come back in studio with you, Mr. Mark. So with that being said, if it's going to give Ghanaians the ability or the availability to purchase drugs online, are the drugs also going to be categorized in the sense that, you know, what can be purchased online and what cannot be purchased online in terms of how intensive the drug is, or any drug can be accessible through the EPharmacy?
Well, I think there are two answers to that question. Well, there are some drugs that cannot be purchased with a prescription.
Yes.
Right? So that is not going to change. And there are other drugs that you can purchase over the counter. You walk into the pharmacy, I have a headache, you buy whatever you need to buy. The good thing about the implementation of the EPharmacy is those drugs that require a prescription need to be verified drugs in the sense that if the system is connected to the FDA, as the Vice President has stated, then people will know that they are purchasing the right drugs, not counterfeits, right? So that is a very critical component of it. Now, when it comes to the over-the-counter medication as well, if you are buying it online, and this system, once again, is connected to a drug verification database or system behind it, you are quite sure you are getting the right medication, which I think is quite important.
Okay, so, but my point is it also going to put pharmacies out of jobs? Because are the pharmacies going to supply the drugs, or there is another organization altogether under the EPharmacy who will implement these drugs?
Well, I don't think it's a pharmacist providing the drugs. It's a matter of having an integrated system where the patient will be able to, for lack of a better word, look at the pharmacy within their vicinity. And one, to find out if that pharmacy has the drugs that they're looking for, or two, the drugs that have been prescribed for them. Right, so they can they can order that drug from that pharmacy. What needs to happen is, how do we get all these pharmacies integrated into this national system to make the patient selection of the drug possible? Right, I think that is one of the critical things we need to think about. As a pharmacist, I'll be happy to do that. But what it does is that it expands my brand. Right, today I might be selling to the folks in East Legon only. With the implementation of this platform, I might now be able to sell to somebody beyond my immediate vicinity.
Yes.
For a couple of reasons. One, I have the drug.
Yeah.
Two, my price might be cheaper. And
Yeah.
three, maybe I have some very good reviews
Yes.
from others who have purchased from me. In that case, others may want to buy from me. So the expansion of the brand is important. However, still, there are other things that the pharmacists need to take into consideration. Would I want to put my prices out there for others to see? Right? The issue about price transparency then becomes very, very critical.
But isn't that also going to benefit the people in a sense that if I know that this is what the price is for this particular medicine and it should be regulated across all pharmacies, or does it depend? To be honest, I have this question. So one time I went to a pharmacy and I purchased a drug, and I was around a certain area. So a few months later, I wanted to purchase the same drug, and I went to another pharmacy at another, community, and they were slightly a bit much more expensive. And when I told them the price that I bought it for initially at this other place, they said, oh, they have maybe different people who supply them, different supplies. So that's why maybe their cost is higher. So with the e-pharmacy, don't you think that it will probably regulate the pricing in terms of transparency?
Well, I think regulation is a bit of a strong word,
Yeah.
right? When you say regulation, that tells me that somebody's telling them how much to sell the drug,
Yeah.
right? So market forces can determine the price eventually,
Yeah.
right? So if you put your price out there and pharmacy B does the same thing, you as a patient have the option of looking at those two pharmacies and deciding where to go and buy.
Which one you want to
Eventually, all the prices information out there will help drive the prices down. I mean, that's what we would like to see.
Okay. So now, Andrew, one thing that jumps out when you look at the policy is the service charges. So it says that the cost of access to e-pharmacy services is free of charge, and registered users or patients only pay the cost for the delivery of the drugs. So do you think that it's sustainable here in Ghana, looking at the way, when we hear the word free, we don't also think about the amount of work or the amount of money that needs to be pumped into it for it to be free. So now, do you think that such a policy, making it free, can be sustained right here in Ghana?
Yes, I do. And I think once we say it's free to the patient, doesn't mean the platform or the service provision is free for everyone. So one thing about the National Electronic Pharmacy platform is every pharmacy that's going to be subscribed into that, every pharmacy that's going to provide a service on this platform is going to pay, should I say, a service fee. So just like every retail pharmacy or community pharmacy you see pays an annual renewal fee to Pharmacy Council, which is our regulator. Similarly, they are going to be regulated separately for the electronic pharmacy platform. So we're paying renewal fees on an annual basis, and all these fees will go to make the service sustainable. So it's free to the consumer, to the client, to the patient, to make sure that as much as possible there's access to care. But for the pharmacies that do the service provision, they have to be regulated and will be paying service fees for that.
Okay, but would you say that there is a foreseeable reason or situation where people might find a loophole in the e-pharmacy policy and take advantage of, the situation, especially when it comes to the purchase of drugs? Do you think that can happen with the new e-pharmacy policy?
So I think a lot of stakeholder consultation has gone into this project, and I think there's been a lot put into it to minimize that risk. One of the things that has been done is often people complain that they walk into pharmacies and they don't get access to pharmacies. With this e-pharmacy program, the only person you deal with, or should I say, the person you're most likely to deal with directly in the e-pharmacy program is the pharmacist. So the likelihood of drug abuse is minimized. Apart from that as well, every patient or client that accesses the portal, that signs up for the portal, will sign up with a unique identification number that might be tied to your passport or your Ghana card.
Okay.
It has to come with a valid ID. So
Yes.
there are a lot of measures placed to minimize the risk and curb
Okay.
any potential for abuse.
Okay, all right. So now, when it comes to the disconnect between our grandmothers, for example, and grandfathers who can't necessarily read or write, and or who don't even have smartphones. With that being said, what measures are being implemented for them to also use the e-pharmacy?
I don't know specifically what is
Yeah.
being done for them, but like with everything, right? It's a new policy.
Yeah.
It's something that has been introduced. We may have to take the 80-20 rule here. So with time, and I believe that the governments and the stakeholders working on this are putting together some roadmaps to address all of these things.
Yeah.
So from the outset, yes, that could be a difficulty for some of our older populations.
Yes.
But I'm sure with time, all those things will be addressed. That's one. And secondly, I think that issue itself presents an opportunity for some young entrepreneur to come up with something, right, to help close that gap, right? So even though it's a problem now, I see that as a huge opportunity for somebody as well to come up with something to help close that gap.
Okay.
But right out of the outset, yes, that could be a problem.
Okay. So, but you mentioned that FDA will also regulate, the drugs that pharmacies will eventually put out there for potential registered users and clients to purchase through the e-pharmacy. But with that being said, would you say that there is also a high risk of competition amongst pharmacies out there in terms of, the demand? So, for example, like you mentioned, I'm sure there are quite a number of pharmacies at East Legon, for example. So if I'm at East Legon, I want to purchase a drug through or via the e-pharmacy, how would the system now give me the actual pharmacy to purchase it from? So, for example, maybe this pharmacy might have it, this other pharmacy might have it, but they are all in one area. So how will the system regulate which one to provide me with the drug that I need?
Well, I think it starts with two things, right?
Yeah.
So let's look at today. When you go to your primary care doctor and you are given a prescription, it's written for you,
Yes.
and you take it to the pharmacist and you buy it. With the introduction of e-pharmacy, I see other things happening. Are we going to ask these patients, we are not asking these patients to go with a paper, right, prescription. We say they're going to use their smartphone. Now, how does a prescription get to the smartphone? Right, it's either the primary care doctor has an electronic medical records platform from which they can submit that e-prescription to that patient, then that patient then will have to upload this into the e-pharmacy platform, right? So all those things need to be in place for this to work. If not, then it's a matter of the patient, I don't know, taking a picture of some document and uploading it, which then means that that platform should have the capability to be able to read that picture or image, if you will, or do an OCR into some system. And then the patient will be presented, I guess, a list of pharmacists within that area who have that drug. If
So
that's
it's
the way it's
up
intended
to
to work.
the registered user to select whichever pharmacy they want to buy from.
Exactly.
It's not, okay, so the system does not, tell you that, okay, this is the pharmacy for you. But there will be, for example, a list of pharmacies where the user can purchase the drug that they need from.
Yes.
Okay,
yes,
all right. That makes much more sense in terms of, not necessarily pinning one pharmacy against each other in terms of competition.
No.
So, okay, so now considering, actually I've already asked that, so what safeguard would you suggest to ensure that customers' data is not compromised?
Well, that then talks about data security and computer security and all of that, right? So let's look at it, let's say from two perspectives.
Yeah.
One is the customer's own cell phone or device. How secure is that device?
Absolutely.
What security protection do you have on it? That's one. And two, you go to the institution or organization that is managing this e-pharmacy system. What safeguards do they have, right, within that environment to ensure that one, you don't provide access for people to compromise the patient's data. Right, so there is a question of data security.
Yes.
One, and with that, also from the, what do you call it, the primary care physician who has an electronic medical records platform, right? Sending the e-prescription across the internet, right? Are these things being sent encrypted, right, in transit? And when it gets to the e-pharmacy system, those things also encrypted. There has to be some security protocols put in place to prevent the data theft, right? So that is one component of it. And also whatever security systems that are being put in place to safeguard, you know, the data storage systems, right, where these things are. And they, like I said, you can have very sophisticated technology equipment to protect data. That is one bit. However, you also have to ensure that the users of these systems do not mistakenly introduce ransomware and malware into your environment. And how do you do that?
That's the question I was about to ask. How can that be achieved? Because really you cannot monitor what people do on their phones. So is it the system that is going to prevent those viruses from attacking the system, or the policy will have to eventually implement something to make sure that the people do not invite these viruses onto the system?
Well, I'm sure whatever system is being put in place will have the appropriate security protocols, right, applied to them to prevent that. But the users ourselves also have to play a role, right? I mean, a lot of us are using free email systems like Gmail and all of that. And through the use of those systems, phishing takes place. And now what is phishing? Somebody will send you an email. You will not even look at the sender properly. Has a link and you click on that link. Once you do that, potentially some malware will be dropped onto your device. And from there, it will sit and collect data.
So this, the implementation of the e-pharmacy policy will also have to come with a lot of education and awareness.
A lot of education and awareness. And both for the patient and then for the staff who work in those institutions, right? Because a lot of people use corporate systems to check their emails, right?
Absolutely.
And then there, you can also introduce those malware and things like that.
All right. So, Andrew, my question to you now is, you know, pharmacies in Ghana already have their own clients. So what incentive would make them want to adopt this service?
Okay, so I think the primary aim of this service is providing access to care. And I think as pharmacists, that is our goal, and that is, we call ourselves friends of the humans, and truly that's what we are. We really want to provide access, good access to quality care to the citizens of Ghana, and that is the goal. I don't think any other incentive really needs to be there. And on a daily basis, you get patients asking for where they can find this drug or that medicine. And really and truly, even though you might have your own clients, you might not be able to meet all your clients' needs 100% of the time. So just being able to have a service where might be someone you know, a family member, your grandma somewhere in a village somewhere, and she needs a medicine, and your pharmacy is in Accra, your grandma is in somewhere in the northern region. How are you going to locate that medicine for her? I don't think you really need any other incentive in this case to sign up to the service. Yes.
Okay.
So yeah, I think that is really an incentive to make sure that everyone everywhere has equitable access to healthcare.
Okay. All right. So let me read some of the comments coming in on our WhatsApp number. So this gentleman said, one thing that we need to discuss is that pharmacy goes beyond business. The counseling part, drug utilization, review part, these are not businesses. They are life-saving aspects. Drugs can be treated like groceries. Okay. So,
I mean, that's a very valid concern, right? Because, like I said, once you walk into the pharmacy, you have an interaction with the pharmacist or whoever is there, right? And people sometimes establish relationships with them, right? Especially if you live in that area. So that's quite important. Because the customer experience is also quite important. Now, when you move this online, you lose that personal touch. So how do we compensate for that, right? That is one thing. So as part of this policy, like I stated, I see that as creating opportunities for other businesses, right? So because you need somebody to talk to. If you go, let me give you an example. A couple of weeks ago, I wasn't feeling very well.
Yeah.
So I walked into the pharmacy and said, can I get some Zitromax? So the pharmacist came and asked me a couple of questions, trying to ensure that I really needed that.
Yeah.
I provided those responses and I got the medication. Now let's take this online. If you don't feel well, you want a pack of Zitromax, what do you do?
Yes.
Right, so if you look at this system as it's been prescribed, that means that I go online, maybe I'll put in my digital address, I look in my neighborhood, I found a pharmacist that has a Zitromax, and I want to purchase it. What do I do?
Yeah.
Do I just take my card, click on it, and purchase it? At that point, does the pharmacist intercept that transaction and ask me these questions before we do that? So the human touch, very, very important.
Exactly.
And we have to figure out a way to compensate for that on this online environment.
Yes. Okay, Andrew, and what is your thought about that as well? Because one thing that this viewer has mentioned is, the counseling part of it, how to even utilize the drug and, the one-on-one conversation that you go and you have with the pharmacist. Because I remember one time I think it was World Pharmaceutical Day, and we had a few pharmacists here in studio, and one thing that they mentioned is that is even in your right to demand for a pharmacist when you go to purchase a drug. You have every single right to say, do you know what, I need a pharmacist to come and look after me and, give me the right drugs for me to treat whatever illness I have. So with that being said, if I can't get that kind of service, what exactly is the purpose of the EPharmacy? I mean, we are looking at it as from a business perspective, but we're not looking at it from, a more saving lives and making sure that some drugs are not abused or some drugs are not wrongly purchased from pharmacies. So how can we also deal with that?
Great question. So I want to put the EPharmacy in perspective. So first things first, EPharmacy is not here to replace the brick and mortar pharmacy. Also, one component of the EPharmacy portal is you can actually just go onto the portal and book a call with the pharmacist, just to speak to the pharmacist, just to ask him, oh, you got this medicine, or you have this medicine at home, you got it 3 months ago, you don't know how to take it, you forgot how to take it, and just speak with the pharmacist. As I mentioned earlier, with the EPharmacy portal, there's going to be a designated pharmacist for every EPharmacy. So you can just book a call with your favorite pharmacist. Every pharmacist and every health practitioner is going to be registered on the portal as well. So it's not just there to sell medicines in that context. No, it's there to provide pharmaceutical care services. So you can just go on there and schedule a call with a pharmacist and just ask questions, get counseling. There's a key component of the EPharmacy portal as well, is counseling. So even for drugs that are being delivered, a part of the EPharmacy concept that has been put out there is there has to be a call made to the patient from the EPharmacy to counsel the patient on how to use those drugs. Apart from that, I think earlier on you asked a question about controlled drugs or drugs that can be abused. One thing is there are drugs that are not going to be allowed to be sold in the EPharmacy. For example, narcotics and psychotropic drugs. So these are like the cocaine. Some of these drugs are not going to be sold with the portals and its derivatives. So there is a threshold within which for those group of drugs, those schedule of drugs, they are not going to be sold or dispensed through the portal. However, it's important to realize that the purpose of the portal is not to make any pharmacy rich or to boost sales, it's for access to care. And pharmacists are there to provide good quality care and to provide that access to care and to provide that good quality information on medicines and how to take the medicines and good counseling. Hope I've answered the question.
Yes, you have. And one more thing before we wrap up the conversation I wanted to ask is if we see any businesses birthing out of the EPharmacy, I mean, right now we already know that it will be delivered to the patient or to the registered user. So obviously we know that delivery services are going to sort of benefit from this. But are there any other businesses can actually surge from this e-pharmacy policy?
Of course, I think that, with every new thing, like I said, might not be able to, the e-policy might not be able to address 100% everything in that value chain, right? So I think along the way, as this thing gets implemented, gets rolled out, there might be opportunities for others. I can think of one now, apart from the one about finding a way to help our older folks to get the medication.
Yeah.
But I think along the way, other opportunities might come up, because for some young enterprising entrepreneur to take a look at it and then
find the loopholes.
Find a loophole and put something there.
Yeah.
I think this is something about, we're in the digital age, right?
Absolutely.
So
absolutely.
I'm sure there'll be things that will come up, but I cannot think of one at the moment.
Okay, but Mr. Mark Agri, do you have any final words for our viewers watching us today?
I think it's a very laudable idea for the government to introduce the e-pharmacy. And as the young man stated, it's about healthcare.
Yes.
Making sure that there are positive outcomes for us when we're sick, when we interact with our medical doctors, or when we interact with the pharmacists to get the right medication, get the right advice, right, for us to take the medication. I mean, I would like to, some of the things I do not know about is whether the system is going to do things like do drug-to-drug verification, because sometimes you cannot mix some drugs. So I'd like to know that or think that there'll be things about drug-to-drug interactions being done. But then I want to come back. The other thing I think a business that can come up is, I know a lot of the primary care physicians have electronic medical records platforms that they use. That is what I'm also trying to do, introduce electronic medical records.
Yes, I actually even wanted to ask you about that, what you're trying to implement in terms of technology when it comes to the pharmaceutical sector.
Yeah, so a good electronic medical records platform will be able to do some of these things, right?
Absolutely.
Do the e-prescriptions, right? And then for those that are existing today that do not have that functionality, others can come in there and provide quote-unquote add-on tools to enable that to happen. So that is one business that can come out of that.
Yeah. Absolutely. Oh, brilliant. Okay, and Andrew, any final words to our viewers watching us today with regards to the e-pharmacy policy?
So just to add on to what Mr. Mark said, I think any business that would pop up as a result of the e-pharmacy policy would have to also be highly regulated to ensure people have access to the best care. And I think that pharmaceutical services are already highly regulated. And currently, the benefit of this e-pharmacy portal is it provides consumers to access to quality care that is regulated, that they know the source of. Because right now, in light of COVID, we find that there's a lot of sales of pharmaceuticals and medicines online, through social media, and a lot of platforms. And consumers can't get, duped or can't get counterfeit goods or can't get misled easily. And we saw a lot of misinformation as a result of during COVID. So I think this is an easy and reliable way and safe way for consumers to get access to good quality information on the medicines they're taking, the drugs they're taking, and as well as give the healthcare practitioners good information on patient history that the patient would give access to the healthcare practitioner because they are data protection laws. And I think all in all, it's a very good step in the right direction for Ghana and for the population generally. And I think we're ahead of the curve.
Okay. All right. Well, thank you very much, Andrew Ni Ofori Anan, who is a member of the Pharmaceutical Society of Ghana, Greater Accra Media Coordinator, and also to Mr. Mark K. Agri, who is the CEO of Prime Care Digital Technology Solutions. Thank you very much for joining me on this conversation today. It's been a pleasure. I've learned so much, and I hope that our viewers were able to take one or two things with them as well with regards to the e-pharmacy policy.